Welcome to my channel. To keep the vagina moisture in women, some fluid is always secreted in the vagina. These fluid are usually called white discharge or vaginal discharge. The amount of white discharge in a woman's genital area varies based on menstrual cycle. Depending on the menstrual cycle, it can be sometimes be less or more. Sometimes variation in color and thickness can also be observed. Many sisters have asked me why there is a slight presence of blood with the white discharge. Is it a sign of pregnancy or is it due to some illness? I will try to discuss these topics in videos. So let's get started. Before that, we need to understand why women have white discharge secret in the genitalia. The female genital area harbors various microorganisms like virus, bacteria and fungus. The secretion of fluid serves to protect the reproductive tract from this microorganism. Let me explain. Any liquid with a lower pH is acidic. The pH of the fluid discharged in woman's genital area is typically around 4 to 5, making it acidic. Due to this acidity, bacteria, virus and fungus find it difficult to infect the reproductive system. Due to the acidic nature of vaginal discharge, the color of the underwear may change. This can lead to concern and fear among many women, but it is entirely normal. So, it is understood that the white discharge secretion in the genital tract is not only normal but also beneficial. It is important to note that sometimes due to the various diseases, women may experience abnormal discharge. I have a detailed video on my channel that explored the both normal and abnormal vaginal discharge. You can watch in the playlist on my channel. Additionally, I will provide the video link in the description box for your convenience. I hope you find it informative, inshallah. Now let's discuss our main topics. Why does light blood comes with a white discharge? We have already learned that women experience discharge in their genital area. First of all, you need to note at what time of the menstrual cycle the blood is coming with your discharge. If you notice that the blood is coincident with your menstrual cycle, especially during the days when you are actively menstruating, it is natural for menstrual blood to mix with the discharge. Alternatively, if your menstruation has recently ended 1 to 2 days ago and you suddenly noticed light blood with your discharge, it could be that a small amount of menstrual blood is still mixed with the discharge. Or if your menstrual cycle is start on 1st day of November and end 5th day of November and you observe a small amount of blood mixed with the discharge around the 14 or 15 November, it could be sign of ovulation. Ovulation is the process by which an egg is released from the ovary and some women may experience light bleeding during this time. It is important to note that not all women will experience this and there can be other reason for spotting or light bleeding. Additionally, if you are trying to conceive and notice light blood with your discharge 3 to 4 days before your expected period, it could be sign of implantation bleeding, which is pre-pregnancy symptoms. However, it is essential to keep in mind that seeing such a discharge does not guarantee pregnancy, as sometimes this can also occur before the start of regular menstrual period. Therefore, to confirm pregnancy, you need to miss your period and urine test should come out positive. It is crucial to understand that experiencing light bleeding or spotting before your period does not always indicate implantation bleeding. Sometimes it may simply be normal variation of your menstrual cycle. To determine if it is implantation bleeding, you need to wait until after your expected period, and if you miss and it get a positive urine test, then might be sign of pregnancy. In many cases, if you observe light blood with the discharge during this time, it is usually mild and you may not need to use any pad and it is typically temporary, lasting only a day. So If you see this light blood and it is not accompanied by other concerning symptom, it is considered normal. Sometimes the blood may have light brown color due to chemical reaction with the acidic nature of the discharge, a process known as a oxidation. Furthermore, if your menstrual cycle is irregular or you are using any contraceptive pills, you may also experience this type of discharge. Now let's discuss how can you understand if it is due to the medical condition. Number 1, age factor. If you are 45 years of age or older and notice blood with discharge, it could be cause for concern. Number 2, timing during the menstrual cycle. If the discharge occur in between your period and at least more than 2 days, it may be case for concern. Number 3, if you experience symptoms such as fever, abdominal pain or any unpleasant odor along with blood mixed discharge, it may be sign of uterine infection. Number 4, if you observe blood with discharge during pregnancy, it considered a sign of potential complication and should be addressing properly. 5. If you experience pain or discomfort during intercourse along with blood mixed discharge, it could be sign of problem. If you notice this symptom along with blood mixed discharge, it is crucial to seek advice from a gynecologist. Ignoring this sign may lead to complications, so it is essential to consult a doctor for proper evaluation and guidelines. Hope today's video was helpful for you. If you find the video helpful, do not forget to share with your friends. Please subscribe to the channel to get health advice, health awareness and reproductive health related all the videos. And remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.